Okay, great. So let me pass over privileges to Susan Davis.
Hello, everyone. Can you hear me okay? No feedback. Okay, good. You can.
Thanks.
This morning or this afternoon, or depending where you are, today I'm going to talk about monitoring and some examples of monitoring for water services, sanitation, and hygiene, as well as for the NTDs. So the WASH NTD roundtable discussion that was mentioned, I believe, in the last module, identified mapping and monitoring as one of 4 important areas for collaboration between the 2 sectors. A few of the opportunities and next steps that they identified in that discussion were to create a centralized resource for all available maps and data related to WASH and NTDs, and you'll hear more about maps in the next part of this module. To compile a list of indicators that are currently used by the WASH and NTD control program and determine gaps, and to establish common indicators for WASH and NTDs realistic to mapping efforts. My understanding is these activities are ongoing as we speak, but it sets the framework for why we're talking about monitoring in this module. So this might seem pretty basic, but I thought it would be useful to start talking about, at least have a common definition for what we think monitoring is. Often you'll hear it in the WASH sector, at least, called M&E, put together like M&Ms, but it's really 2 separate activities. And they take different time frames, they have different goals, they're done by different people. But for the purposes of today's conversation, monitoring is a systematic collection of data using the same indicators and the same process. So if it's a systematic collection, when should you monitor it? Before an intervention, often it's called the baseline evaluation, baseline monitoring. During a program, you can monitor the progress of the program, how it's going. And after a program, it's sort of a final snapshot sometimes, or sometimes it's at regular intervals. And then ongoing monitoring might be for health statuses or ongoing services, for example, for water services. So who monitors? There's a variety of folks involved in monitoring, and we often sort of think about it for our program, but there's various places that monitoring happens or should happen. So you can see here, this is just a few of the types of people or stakeholders who are doing monitoring and for the reasons why they do it on the right-hand side. So I won't read this to you, but you'll see there's program managers, obviously might want to do monitoring during a program. Implementing organizations might want to look overall at their programs around the world or around the country to learn from their work and make it better. Service providers might be, in our conversation, we're talking about water, sanitation, and hygiene, so this might be a water service provider, it might be a sanitation service provider, but they want to know how they're doing, so they do ongoing monitoring. It might be a government service provider who wants to make sure that their services are of high quality. And then national governments, as we've all heard about the joint monitoring program to see where we stand against the Millennium Development Goals. That's a form of monitoring as well. And often all of these sorts of monitoring don't necessarily connect. So when we're monitoring, what are we looking for? Often you'll hear monitoring for a program. So you talk about your outputs. How many water systems have we built? How many toilets have we installed? How many hygiene trainings have been conducted? And then for outcomes, it's often a little trickier. You know, are we improving health? Are we decreasing the rates of diarrhea? For NTDs, are we decreasing the prevalence of these WASH-preventable neglected tropical diseases? Your monitoring can be quantitative or it can be qualitative. And again, how you do this depends on what you're trying to accomplish. So again, this whole presentation might seem kind of obvious, but why is monitoring important? Well, it's not just to know how many things we've built, but it can be used for accountability, both to the people we're trying to serve, as well as to maybe donors or government, to ensure an effective intervention. If you use the data to change the way you work or to improve the way you work, it can make your intervention more effective, to ensure ongoing services. And the last one that we might not think about is to prevent or correct unintended consequences. Here's another reason why I believe strongly that monitoring is important. This is a rather rough estimation of global failure rates of water points around the world. And it's the red line indicates failures, outright failures of a water system. And the yellow line indicates failures and those systems that are very close to failing, that have poor functionality. So you can see the rates are pretty high. They started in 1997 with about an average of 50% failure. And currently we have about an average of 40% failure, and that's just with the data we have so far in 2013. And these are, some of the studies are small programmatic studies, and some of them are national mapping and monitoring studies. So you can see there's a very strong need for us to monitor our work in the water, in the WASH sector and the water sector particularly. Here's another reason why it's important to monitor. This is an example from the SWASH Plus research, School Water Sanitation and Hygiene Research, where they looked at 3 types of interventions. I won't get too much into depth, but in the middle you can see there was an intervention that involved hygiene promotion, water treatment, and sanitation, which means toilets at schools. And what they found is that there's actually more fecal contamination on the hands of the students in places where there are toilets, which is quite counterintuitive, but something that was really important to understand and to work on. So again, another reason why it's pretty important to monitor. So lately, in the past few years, there's been a way of rethinking about monitoring for water. And you'll see sort of the before on the left-hand side and what the current thinking is on the right-hand side. So for example, instead of just counting infrastructure, counting pumps and pipes and water points, moving towards the idea of monitoring services and the conditions that will ensure sustainability. And that implies a different time frame, a different set of people to actually do it, maybe different skill sets, institutionalizing monitoring. We're moving from this unstructured ad hoc data collection, which might be just for a program, it might be just for one organization, it might be for one region, towards an idea of continuous data collection and structured analysis. And again, from each side, you're sort of thinking about a completely different way of monitoring and who does it and where the data are stored and used. So in that line, we're moving from restricted access to monitoring data, where many organizations, they might have really interesting, useful data, but it's only used within their organization. And we're moving towards easy access to real-time monitoring data for all. And some of that is being facilitated by the prevalence of things like cell phones and cloud databases, access to internet, those sorts of things. That's making it easier for more people to access data. There's an initiative going on right now in the U.S. to collect some of the monitoring data, at least around functionality, and put it in one place, at least the commonalities. Right now, it's hosted on a place called sustainablewash.org. But it's really interesting to be able to look across the data from various organizations in various regions and see what all of this monitoring data has in common. The last point is that we're moving from monitoring as an end, as in we've done our monitoring, we can check that box, to using the data that we collect to actually inform planning and provision of sustainable services. So I wanted to give a few examples of some monitoring that's going on. I couldn't find too many where there were overlaps between monitoring of WASH and NTDs, but that's why we're talking to you about it today. So here, this is an organization called BRAC, that many of you will have heard of, and they wanted to monitor hygiene behavior, which is, as many of you probably are aware, is kind of tricky because hygiene behavior needs to be practiced every day, several points during the day, and actually observing it can be difficult. And when you ask people, you sometimes get the answer that they think you want to hear. So BRAC wanted to monitor good hygiene behavior practiced both at the individual and the community level. And particularly, they were looking at hand washing with soap after using the toilet or defecating outside, hand washing with soap before eating, and use of safe water sources, safe storage, and safely storing your water. So they looked at both qualitative and quantitative indicators for hygiene behaviors. And you can see the quantitative might be the things that we're used to measuring. You know, how many meetings did they have? How often were the stakeholders provided with hygiene promotion? How many people actually constructed latrines? But then there was the qualitative, which was sort of tracking how the water was stored, moving from source to mouth. As many of you know, probably the water often loses quality as it moves from the source to the storage. So using the safe storage as well as safe water sources was something they looked at. And then they also looked at the availability of hand washing facilities and whether they had soap. So they were calling it a performance monitoring system, and it's relatively new. So I can't tell you what the results are at this point, but it's just an example of ways to monitor something that might be considered fairly tricky. This is another fairly new program that's started by CDC, which is the Centers for Disease Control and Prevention in the United States. And they have a program called Wash Away, NTDs. So it's linking water sanitation and hygiene interventions with the prevention or control of neglected tropical diseases. And the CDC has, if you're familiar with it, is very good at monitoring disease and using that information to try to prevent disease. So this makes sense for them to leverage their relationships with health organizations and academic institutions. But what they're trying to do is evaluate the effectiveness and the impact of a comprehensive WASH package on these WASH-preventable NTDs that we heard about in earlier modules. They wanted to study the enabling factors and the barriers to WASH delivery and integration within both prevention of NTDs and the prevention of diarrheal disease. And they also wanted to look at the cost and sustainability of integrated WASH interventions. So this is something we should all keep our eyes on because the findings from these evaluations will inform what we're trying to tell you about here in these modules. We can have even further evidence base for how to use WASH to prevent NTDs and how to integrate WASH into existing NTD programs. So it goes both ways, not just making the WASH practitioners think about NTDs, but making the NTD practitioners think about WASH. This is another program I learned about recently that I thought was interesting because it's this idea of institutionalizing monitoring and localizing the monitoring. So it's not just an outside NGO coming in when they have time or funding, but it's actually built into the national system. So in 2012, the Ministry of Water, called DNIPA in Haiti, they hired water and sanitation municipal technicians in rural communities. And they first started with a water point inventory. The idea was to see, just to know what's going on in the country, in the rural areas. And you could see they found pretty poor functionality for water kiosks and wells, and not much chlorination was happening for various reasons. So they now know what they need to focus on. So these maintenance folks, some people might have heard of the idea of water mechanics associations or circuit riders. this is similar to that, where they will go around and work with the rural communes to make sure that water is being chlorinated, try to help them with technical issues and access to supply chain for chlorine and maybe the actual chlorinators, the chlorine dispensers. They will report these indicators back up to the national level, which then you can use, they can use for planning and better prioritizing of investments. And in Haiti, as you may have heard, there's a big problem with cholera. So chlorination of water and safe water is a huge issue for preventing a particular disease. But of course, it will help prevent other diseases as well. So this is, again, another type of example of a different level of monitoring and how it's being used. So I'm going to look into the future here. I invite you to look into the future with me. The services or post-implementation monitoring, which is something that's been, let's say, neglected in the WASH sector, is becoming it's becoming facilitated by cell phones and databases in the cloud and that sort of thing. And there's becoming more of an understanding of the need for it. But obviously, if you monitor services of water system over time, that can lead to sustainable services if you look at the data and use it. And those sustainable services will in turn help reduce the WASH preventable NTDs, along with diarrhea and many other issues that poor people without access to water face. So this ICT is information communication technology, so that's cell phones and internet and all of that sort of thing. It does help with efficiency of monitoring, but it doesn't solve the problem of thinking about how to deal with the data. So you still need people and brains to think about how to use it, as well as institutional structures. The digital data that we can now collect, instead of collecting monitoring data on pieces of paper and somebody having to enter them, the ability to collect digital data directly is going to promote, and is promoting already, the ability to map and layer information for better targeting. And you'll hear more about that exciting work in the next piece of this module. There have been calls at the higher levels for harmonization and standardization of the monitoring landscape at national and international levels. Right now, most organizations have set up their own monitoring, evaluation, and learning frameworks. They don't necessarily overlap with other people's or even the national way of collecting data. And I think there's understanding now that it would be more useful if we all had at least a basic level of common indicators. And there are some existing examples for collaborative monitoring, but obviously we need more. We need to think about the people we're serving and monitor in a more useful way moving forward. So here's another example of collaborative monitoring or potential for collaborative monitoring. That's the recent declaration in Addis Ababa for the control and elimination of NTDs in Ethiopia. Actually has a commitment from the participants to implement, scale up, and sustain appropriate and relevant interventions. And the most important part here is, and track the progress using scorecards. So that will be really interesting to track. It might be a way to kind of borrow their idea and use in other countries. And here I've included just a few of the resources that I used in preparing this presentation. There's obviously much, much more on monitoring that's out there, but I invite you to consider when you do your monitoring, how can you collaborate with others, especially around NTDs. And that's it. Thank you.
Great. Thank you so much, Susan. It looks like we have a little bit of time for any questions or comments. I know that there was already one that came in from Sohail from Pakistan, and he actually sent it to me privately. The question was, who covers the costs of continuous monitoring? And I don't know if, Susan, if you have any experience on that or feedback.
Yes, that's the best question to ask, because that is probably the number one reason why you will not see that much post-implementation monitoring. There have been some interesting discussions at the donor level as well as within the broader WASH sector about this very conversation. And the way of thinking about it now is there's a couple of different ways. One is that the donors are thinking about putting a percentage aside, and this includes the U.S. Agency for International Development. Some of the conversations I've had with them is they're thinking about how to do this. Part of it might be putting a percentage of the funding for each program aside to use for post-implementation monitoring. And some donors are thinking about that as well, or even funding directly post-implementation monitoring. Like the Hilton Foundation is recognizing that they don't really know what the status is of some of the, or many of the water systems that they funded, so they are actually doing some work on post-implementation monitoring. Now that can be just a snapshot. If you think about the services piece, then you need to think a little bit differently about who does that monitoring. If you look at the example of Haiti, that's actually local institutionalized monitoring that will happen over time on a regular basis. And they actually got funding, I believe, from the World Bank to set up this program. Now, how does that maintain? How do you maintain the financial stability of that over time? That needs to come from the local institutions, from the government, and that is a tricky question. So I don't know the full answer to that, but those are a couple of examples.
Great, thank you so much. We have had another comment and question from Sohail. Sohail, would you like to ask the question yourself? You feel free to unmute yourself and ask, since you've had a number of questions and comments. Do we have any data indicating % age increase in communities washing hands with soap? How do we fix such indicators in a 1 to 2 year project? Oh, sorry, percent. Oh, percentage, excuse me. Do we have any data indicating % increase in communities washing hands with soap? How do we fix such indicators in a 1 to 2 year project?
That's another great question, Sohail. Thank you for these. There are studies definitely on the hand washing issue, and most of the ones I have seen show that over time the behaviors decrease, which tend to indicate a need for ongoing hygiene promotion. And again, who does that is something we need to consider as a sector. How do we, again, locally institutionalize that sort of hygiene promotion? I can probably find, I imagine your task force folks might have access to this as well as some of the other participants, but I can find some studies and forward them on to you if you'd like to share your email with me privately.
Another question here from Sohail's group, which is that contributing to decreases in diarrhea, or maybe attributing WASH impact on diarrhea may not be a very realistic option. And the question is how to collect such indicators. And I think this is relevant precisely because part of the discussion today and the purpose of the WASH NTD course is to look beyond diarrheal disease as the only health impact indicator for WASH, and to examine the potential of NTDs and measuring WASH impact on NTDs as a way to attribute health impact to WASH. And Susan, I don't know if you have any comments in particular on that.
Definitely. I think this is one of the big challenges of the WASH sector is to justify that it does improve health. And we have in the past, or for many, many years, focused primarily on diarrheal disease and reduction of diarrheal disease as pretty much the only indicator of improved health, which of course is challenging to measure and even to attribute that it's only WASH that is reducing the diarrheal disease. We all know intuitively that it's good for us to drink safe water, and it's good for us to have toilets and wash our hands. We know that. And it's So it's kind of frustrating to have to prove that it's good for health. But I think there's an opportunity here with the neglected tropical diseases. There are very clear measurements of reducing them, and they have even more potentially more debilitating effects than even diarrhea in some cases. So that if we can start to connect WASH interventions to reduction of NTDs, it might make our case to the people we need to make a case to even more strongly.
A fantastic point, and I think what you allude to is that that'll take not only a change in the way that we monitor WASH projects and programs, but it'll also take a change or a shift in perspective among the larger WASH and disease communities, including donors, which will require that donors and others are interested in hearing, interested in looking at the decrease in NTDs. And just as a brief comment, as we continue in this greater dialogue between WASH and the NTD sector, what we see is that there is an increased interest among donors, and particularly at the moment among bilateral donors like DFID and USAID, to look at WASH impact on the NTDs. And precisely because there is a push to either eliminate or control the NTDs by 2020, there's a certain amount of urgency to tackle the NTDs that can be beneficial to WASH. And so, again, I think where Susan's presentation is very, very relevant is to begin to think about how in our WASH programs we would actually measure WASH impact on the NTDs and connect with the appropriate mapping and monitoring or organizations that are mapping and monitoring disease. And maybe this is a great segue, unless there's any other burning questions right now for Susan in particular, this is a great segue to Dr. Rachel Pullan, who will talk a bit about some of the resources out there to map both disease as well as to map WASH at a subnational level or at a district level, and how we can overlay that data to mutual benefit to the WASH and NTD sectors. Oh, great. So perhaps without further ado, and I see some other questions coming in, and I think they're wonderful ones. So perhaps what we'll do then is that we will save those questions and come back to them after Rachel is done, and then we can have a discussion, I think, after looking at these mapping tools in a more informed way and revive the discussion on how that impacts monitoring WASH programs as Susan began to talk about.
Okay, hi everyone, can you hear me? Am I clear? Can you hear me? Okay, so I'll presume that's yes. So just to introduce myself again, my name's Rachel Pullan and I'm an epidemiologist and I work on NTDs. So I just want to sort of put that caveat out there that my specialist knowledge here is NTDs and not WASH, so we're moving into the WASH sector now. So what I'm going to be presenting on is a number of things. First, I'm going to introduce tools that are available to help us map the distribution of NTDs that are relevant to WASH. And then I'll just talk a little bit briefly about the available WASH mapping tools that are also available. And then a new tool which we've developed that will allow the overlay of these different map sources of data to get a better understanding of where we see lots of worms and where we see very poor coverage of sanitation. And then I'm just going to touch briefly on targeting WASH to communities with high disease prevalence, so how we can use that tool to better target our programs and also measure program impact. So first off, the first question is, where can we look for NTD mapping data? So everyone's first port of call will most likely be the WHO. And they have a data bank where they store all nationally reported data on the prevalence of NTDs. And this is called the PCT data bank. And PCT is just a term that's simply used to describe those diseases which can be treated using mass treatment. So that's intestinal worms, trachoma, lymphatic filariasis. And if you look a little closer here, so this is just a screenshot of what this looks like if you go in to look at the map data that's available. So as you can see, the data is only available at the national level. So it will give us an indication of perhaps how many people are at risk of infection, but it doesn't really help us learn anything about where those people live within a country, how risk varies across the country. So it's not very useful if we want to better target our programs. The next source of data, and this is where we come in, is the Global Atlas of Helminth Infection. And this is a tool that we've developed to provide an open access information resource on data on the distribution of these NTDs, so intestinal worms, schisto, lymphatic filariasis. And the data that's included in this atlas is data that we've taken from national surveys, from published literature, from contact with scientists working within countries and programs within countries. And as you can see here, we've got a map. You just click on the country and that will take you to the data that's available for that country. So the example I just want to show you here is Ethiopia. So if we click on Ethiopia, it takes us to Ethiopia and shows you the maps that are available for that country. And so these are the maps that are available for soil-transmitted helminths. They're the intestinal worms. So if we look a little closer at the maps that are available for that particular country, for Ethiopia, this shows the point prevalence data that's available for Ethiopia. So each one of these dots represents a single survey. And the majority of those surveys are done in school-aged children, because they're the group they're easiest to get to. They're all in school, so it's very easy to do surveys within schools. And they're also the children we're going to be targeting and when we're treating. So each of those surveys is shaded by the prevalence of infection. So any area here that's red, prevalence is greater than 20%, and these are the groups that we will be targeting for treatment. So, and then this map here just shows the district level prevalence. So this is just the average prevalence based on all the surveys that have been conducted in that region. So if we look at this map, we can get a general idea that we need to do deworming across much of the country. Much of the country is at risk for worms. So in terms of targeting, we know in Ethiopia we're going to be treating in most places. But we do know we don't need to treat in this district up here. And this is because it's very hot and dry, so it's not really suitable for transmission. We can also look at the schisto data that's available. And you can see this is much more varied. There's a lot of variation within the country in prevalence of schisto. So in this instance here, we would target treatment for schisto when prevalence is greater than 10%. So that's anything that's orange or red. And you can see here within districts it gets quite complicated, because you have, say, this district here, we've got 2 schools here which are completely negative for schisto, and we've got 3 schools here which have high prevalences. So within this district we might want to do sub-district targeting and only treat those schools where prevalence is high. Okay, so moving on. Another disease that that's of interest is trachoma. And so the data that's available for trachoma is all stored within the Global Atlas of Trachoma. And this is a joint initiative between ITI and LSHTM. And similarly, as for the STH data and the schisto data, this contains all the mapping data that's available for trachoma. Trachoma is a bit more straightforward because surveys are very standardized for trachoma. There's one donation program for the drug that's used, which is zithromycin. And districts have to have a particular prevalence, which has to be done through a robust survey, which needs to be appropriately powered. So they need to survey enough people before they can say whether treatment is needed or not. So if we look at the map again for Ethiopia, you can see mapping has been done through a lot of the country. Mapping is actually ongoing for trachoma in Ethiopia, so the entire country should be completed very shortly. But as you can see, as for the other NTD, as for the worms, there's lots of trachoma in Ethiopia and large areas here. So every area that's red and orange requires treatment. So the NTDs, our next question is what if we're wanting to know how to target both water and sanitation interventions, and I'm going to be just restricting my talk here to water and sanitation. I'm going to be omitting hygiene. We also need to know what the distribution of water and sanitation is within countries. So obviously our first port of call here would be the Joint Monitoring Project. They're responsible for monitoring water and sanitation for the Millennium Development Goals. And if you go to their website, it's very transparent, it's very clear. They've got maps showing coverage in every country, and you can select on particular indicators. So in this case, I selected sanitation. You can go to individual countries and download the data that they've used, and you can download information on rural and urban populations. But importantly, you can't actually get information at a subnational level. So again, that's not very useful when it comes to knowing where to target our programs and where's at most risk within a country. At the other extreme, many of you will be familiar with the WaterAid Water Point Mapper. So this is a tool that's been developed by WaterAid to enable practitioners to collect their own data. So this isn't a source of data for people who don't know what's going on. This is a tool to allow people to collect their own data. You collect your data using a GPS, and then it has a series of tools that help you create maps using Google Earth to visualize your data. So if you're doing a coverage survey, then this is a good way to visualize your data. And just to show some examples here, so this is an example map they provide on point mapping, water point mapping, so the number of people per water point. And here we've got a district level average, so the people covered per water point per district. So this is one way of visualizing your data if you have data available within a country, but you may well not have data available within a country. And this is the problem we faced when we came to and trying to better understand the distribution of these infections within countries. So this map that I'm showing here is one that we developed to predict the risk of ascaris. Ascaris is roundworm. It's one of the intestinal worms. And we were interested in how risk varied across Africa. And the map that we could develop is based entirely on environmental factors, so it doesn't take into account water and sanitation. So we really wanted to know what the general variation in distribution was within these countries. So we did as I showed. We went to look what the general sources were, and we couldn't find any subnational data that we could use that was already mapped. So our aim was to develop our own maps. So we wanted to produce maps that could be useful for both our own research, but also for service delivery providers and policymakers, and use these maps to investigate what variation is in access to water and sanitation within countries. So the indicators that we used, there are limitations to these indicators. They're very crude, but they're the indicators that are used by the Joint Monitoring Project. So we've got our standard improved sources of drinking water. Everyone will be very familiar with these. We've also got our standard improved sources of sanitation here. And the data source that we use, and this is the same data sources that are used for the Joint Monitoring Project, and that's national household cluster sample surveys. And we only included those surveys which we could identify which district or province that survey was conducted in, so we could therefore map at that fine spatial resolution. And so the majority of these surveys, just to show you where they lie, are DHS surveys. You may be familiar with these. These are the demographic and health surveys, a big source of health data across Africa. And this work we've done firstly in Africa, but we are planning to expand this. And you can see here that the better mapped countries, as is the case for nearly all types of data across Africa, are on the west and on the east, and there's a big lack of data in the middle. So these countries in Central Africa here may only have one survey available for each district. However, altogether, if we aggregate all this data, it represents well over 1 million households. This is a very rich data source. And what we did was we developed some models to use this data to predict what access was across countries. And this shows the results of this work for 2012, for the proportion of the rural and urban households within each district that are using improved sanitation. So this is any pit latrine with a slab and above. And so you can see, obviously, this is as we'd expect. Levels are lower in rural households than urban households. There's large amounts of variation within countries. If you look at Nigeria here, it's very mottled. And there's very large amounts of variation between countries. Another indicator that we chose was open defecation. This might be more relevant to some of the NTDs. And the results here are even more pronounced in terms of the variation within countries and also between countries. One thing we chose to look at for drinking water was to use the standard indicator, which is used by the Joint Monitoring Programme. So that's houses reporting any improved source of water. So it doesn't matter how far away that water source is. And this shows the distribution here by district. But we also chose to compare this to the amount of households that were using an accessible improved source. So this isn't actually collected by the JMP, but it's collected in the survey data that's used to inform the GMP. And this only includes households that are using an improved water source, which is either less than 1 kilometre away or within 15 minutes. And this has been chosen as a standard definition of an accessible water source. And you can see levels here are much lower. So even though a lot of countries within Africa have achieved the Millennium Development Goal for improving the population with access to improved water, if we look at actually improved water which is accessible to the household, it's still very low. And if we compare urban and rural populations by country here, it's quite striking. So on the left here, on this axis here, we've got the proportion of households by urban and rural population within a country that has access to any improved water source. And this is compared with the proportion that are using an accessible improved water source. So these points here that are close to this line, nearly everyone who's accessing an improved water source is using one that's accessible. However, the ones down near this dotted line here, so all these countries around here, this dotted line represents 50%. So anything on this dotted line, only 50% of the households which are using an improved water source are using an accessible one. So this shows there's a big shortfall in the number of households that are able to use an accessible water source. And there's big differences here for rural and urban populations. So in East Africa in particular, Rwanda, Uganda, Burundi, the rural populations, only half the rural populations that are using an improved water source are using an accessible one, which is quite striking. Just to show you the maps at a national level here. So this just shows in a little more detail access to improved drinking water source. So this is any drinking water source for Ghana. And so on the right here, this just shows the data that's available. So each of these points is the national average based on the survey. And this straight line here is the model results. So this is the prediction results. And so you can see they fit pretty closely. And so Ghana has achieved the Millennium Development Goals for access to improved water. But if we look at it here, you can see there's big variations. So particularly in rural populations in the east of the country, there is still sizable numbers of people who aren't accessing improved drinking water. And if we look at this across the continent, the within country range, so the average per district accessing water varies from 58 to 95, which is pretty striking, but in some other countries this variation is much greater. So if you look at Nigeria, the lowest covered district is only 14%, whereas the highest coverage district is 93%. So this shows there's huge amounts of inequality within the countries. This is even more striking for improved sanitation. So if you look here, this is the proportion of rural households that are accessing improved sanitation. And you can see as we move north, it's getting much lower. So in the north of Ghana, fewer than 50%, and here even fewer than 25% of the population have access to improved sanitation. And again, the variation here within some countries is particularly striking. So if we look at Angola, and in the lowest coverage districts, only 2% of the population have access compared to 93% in the highest coverage districts. So there's huge amounts of inequality here, and this isn't apparent if you just look at national statistics. So this is very powerful if you're wanting to advocate for targeted programs within countries. If you have this sort of data, you can make a much stronger case for the need to target these low-covered populations to increase equality and access. So now we have this data resource. There's lots of things we can do with it. We can use it to investigate what's happening in terms of inequality within countries, and then we can also use it to understand the distribution of NTDs. So we can use it for local level planning and evaluation of control programs. However, one problem at the moment is what I've shown you. It's all very well, but the water and sanitation maps I've shown you, they're available in a publication. They'll be available on this Wormy World, but they're not necessarily easy to overlay with the NTD maps. These NTD maps I've shown you as well, they're also static. You go to the website, you can download that map and include it in your reports, but you can't necessarily customize the map to look as you want. And it's very difficult to overlay the maps and see sources of information. And so driven by this and wanting to make these maps really useful, there's been a launch of a recent initiative, and this is an initiative led by Task Force, to develop an NTD map, which is a single open access mapping platform that brings together all the data, which will allow you to then overlay water and sanitation data with prevalence data for all the relevant NTDs and therefore make better decisions on targeting. So just to go over the aims of this project, so the primary aim was to visualise the distribution of NTDs, allow people to identify priority areas for MDA, which is mass drug administration, treating everyone for worms, and then use these to identify potential areas for co-implementation. So where we can implement both water and sanitation programs and NTD programs. We wanted this tool to be simple to use, to contain all the relevant information, and also be open access. So it has to be available to everyone through the internet, adaptable by people through the internet, and readily able to use for non-experts. We don't want a mapping tool which you then have to go and do a course to learn how to use. So this mapping tool combines information from all these different resources that I was telling you about. So it combines information from GAHI, which is the Worms Atlas. It combines information from the Jacoma Atlas. It contains coverage information about the coverage of deworming programs for children without worms. And it also contains the water and sanitation data that I was telling you about. So as you land on the website, so I'll just take you through what it looks like. So we land on the website here, and we can pick the disease that we want to start off with. So in this case, we'll pick STH. And it then shows automatically it shows the prevalence surveys for STH, and we can look at it across the continent, or we can zoom in, use either the cursor or the plus minus here to zoom in on the area that we're interested in. So in this case here, I've zoomed in on Kenya, and then we can add additional layers. So the layer that we're interested in at the moment is sanitation. So we can ask it to add information on access to sanitation. And then we can look at that to look at the relationship between and the co-distribution of the NTDs and inadequate sanitation. So you can see here around the coast of Lake Victoria, there's areas which are very high prevalence for STH and also have very low coverage of sanitation. So up here in Uganda and here in Kenya. And these areas suggest regions that would be very amenable to improvements in both water and sanitation and deworming. So lastly, we wanted to look at whether we could use this raw information So information has been collected from different places to better understand what the relationship is between water and sanitation and worms. So we had a quick look at the raw relationships between the two. So we included all the surveys we could find that have been conducted in areas where worms were feasible, so areas that weren't too hot and dry to completely rule out worms. And we predicted the coverage of water and sanitation for the year that survey was conducted. So in total, we had data that spanned from 1990 to 2013. And we had a large amount of surveys, so over 3,000 are included for East Africa and just under 3,000 for West Africa. And this shows here just what the relationship was between the two. And you can see here that there's a strong linear trend. So in this group here, this shows the range of prevalence seen for households which have less than 25% of households have access to sanitation. And in this group here, this is districts where greater than 75% have access, and you can see there's a large reduction here, and there's quite a strong correlation of 0.23. For West Africa, this relationship's not quite as clear, but there's still a very large range of prevalences at low coverage of sanitation and a very low range of small prevalences at high levels of sanitation. So this is hook one. If we look at one of the other SPH, so this is Ascaris, this is roundworm, you can see that the relationship with improved sanitation drops away. So interestingly, there's no relationship between the proportion of households that have access to improved sanitation and the number of people who are infected with Ascaris. But if we look at open defecation here, then we do see a relationship. So when very high levels of people are reporting relying on open defecation, we then see very high prevalences of infection. And this is particularly pronounced in East Africa. So this is just some descriptive analysis that might give us some suggestions that we can perhaps investigate this within our program, so get some more information on this within our programs. And so the last thing I want to touch on, and this is very briefly, is just how can we better measure WASH impact on NTDs? So how can we measure program impact when we're looking at both programs? And there's just a few things that I really want to emphasize, because a lot of this has already come up in discussion. And the first thing is, before we start, we really need to choose which are the most important indicators. If we don't collect information on all the relevant indicators beforehand, it's too late to collect them afterwards. And if we take the example of intestinal worms, one of the most important things to collect for intestinal worms is intensity of infection. We don't just need to know the number of people that are infected, we also need to know how many worms each of those people have. And intensity of infection in STH is recorded by the eggs per gram feces, which are also recorded when we look for presence of infection. And it's those people that have the most worms are the ones that are most risk of morbidity and the most important for transmission. So what we really want to know is how many of those are reduced. And then we also may want to record information on a number of water and sanitation indicators. And these shouldn't be the crude ones that are used for monitoring, necessarily used for monitoring and evaluation. They might want to be more detailed. We might want information on the condition of latrines, as well as just their use. We might want to stratify this by age groups, because we know that younger children are much less likely to use latrines. So even if use is good amongst adults and school-age children, if we've still got a lot of younger children defecating in the open, then we've still got high risk of transmission, and our intervention might not be very good. There's a number of ways that we can measure the impact of NTD and water and sanitation campaigns. And our ideal way would be using an experimental design. So that's actually use a controlled trial, randomise districts to receive the intervention or not. However, this is rarely feasible. If we're doing a deworming campaign, we're not going to exclude certain districts from deworming because we know that when it's required, because we know that deworming is a safe and efficacious intervention, so we can't not do it. However, there's lots of alternative designs, which are known as quasi-experimental designs, which we could think about using. So we could use, if we're rolling out an intervention, say we're starting our water and sanitation intervention in certain districts, and then we'll be moving on as we get more funds to other districts, we can use a step wedge design where we look at what happens as the programme is rolled out. We also need to think about collecting information on all potential confounders. If socioeconomic status is an important confounder, we need to make sure that we've effectively been able to measure that. We might also want to measure other programs. If we have, for example, LF treats people with albendazole, which is also the drug that we use to treat for intestinal worms. So if we're interested in intestinal worms within our study area, and we also have an LF program, we need to make sure that we collect data on this. One particularly strong method for sort of measuring impact of programs is using a difference in difference method. I've just included this briefly, just in case it's a term that you may come across. This is a method where we don't just look at the absolute change in something. We look at the difference in the overall difference between our baseline and our follow-up surveys. And this gives us a better indication for how improvements in one indicator, for example, our intervention, may be associated with improvements in another outcome. So that's sort of a brief introduction to the mapping data that's available. This is just a flyer for the NTD map. So I'd encourage you all to look at it. We'd be very grateful to receive any feedback that you have on the usefulness of this for your own programs. Okay, so anyone have any questions? I realise that I'm sorry if people have had problems with feedback from my computer.
Great, thank you so much. That was an excellent presentation. Apologies to the people who are having a bit difficulty hearing. The information presented in the slide was very useful. Does anyone have questions? It looks like Stephanie has posted something to some of the maps and the resources that Rachel has presented. Do people have questions either for Rachel or for Susan?
I want to thank you for that really, really rich presentation. And for all of us as WASH practitioners, I just want to point out the resources here that are freely available online. And so I encourage all of you to look at them and to see how these apply to your own both country context and then the areas, the districts in which you work, and to see how this information is relevant to you, and would very much appreciate your feedback. So as a WASH practitioner, what in here is useful and what are the limitations as well? And Rachel, perhaps a question for you in thinking through how WASH practitioners can best engage in this with these tools. I wondered if you had any. So thinking from the perspective, and I know that you're not a WASH practitioner, but a spatial epidemiologist. But as a WASH practitioner, how can they best engage with these tools and the health sector practitioners that use them?
Well, in terms of, so I'm not sure if you sort of mean about like adding your own data or, because one of the powerful things with this platform is we intend it to be an open access platform, a neutral platform where we can add data from lots of different programs. So if countries had their own national water point mapping efforts, then we would welcome that data to be introduced into the maps if countries are willing to make these available. And one of the things we're wanting to do as we sort of update this platform is to also have private maps where people can add their own data and keep this private to their own institution. I'm not sure if that answers your question. The maps can also can help to improve dialogue between programs. So these sort of maps showing areas with very high prevalence, these are the areas that will be targeted through NTD control programs. And if both the NTD control programs and water and sanitation programs both have this joint information, it'll enable better dialogue between these two programs to sort of increase opportunities for collaboration.
That's a fantastic point on both counts, one of which I think is the opportunity for the WASH sector to contribute data to these types of tools, and so know that opportunity exists. I think the other is precisely as you say, is the opportunity, and it's a tremendous one, to identify areas with high disease prevalence on the one hand and low WASH coverage on the other. So part of the trouble in working at the overlap between WASH and NTDs is trying to identify the communities in most need, and I think these maps are the best available resource and a tremendous opportunity to be able to do that. I think you also make a wonderful point that the areas that have high disease prevalence, particularly because of the urgency of NTD control and elimination under the 2020 targets, those are the areas that are going to be targeted for intervention by the health sector and by national governments. And so when you're looking for places to collaborate or areas of most urgency for the health sector, that's an easy way to identify them. Thank you for that. And I see Susan. Susan, you've got a couple of questions as well. Susan, you're welcome to unmute yourself and ask if you'd like.
Thanks. I think that Rachel answered the first one about including data from other national mapping and monitoring efforts or even programmatic monitoring efforts. It sounds like that's possible. I'm curious, though, if you're planning to actually pull those in yourself as part of this effort, or maybe you're finished with your project?
Well, we did sort of encourage people to get in touch with Rebecca at the task force, who's actually the lady responsible for overseeing this work. So the details are all available there on the tool. So it will be sort of more people contacting Rebecca and asking for their data to be included, but there is going to be a sort of a number of updates of this tool and new functionality added. And so as that functionality is added, there'll be more opportunities for people to actively upload their own data. So it's definitely an ongoing, it's not a one-point project that will then be stopped. It's definitely an ongoing project that we envisage being of use for a long time yet.
Oh, fantastic. That's great. Thank you. Is there a way the task force folks can share, is it Rebecca, share her contact information? Maybe if the folks on the call want to reach out to her?
Okay, I'm just looking.
I think it's also on the NTD mapping tool. So if you go to the link for the NTD mapping tool that I provided earlier, I believe Rebecca's contact information is there. But we can also send it out as well to participants and let her know that we've done so. Any other questions for Rachel or for Susan? Go back to one of Susan's comments from after her own presentation in response to some of the questions of from Sohail and his group. And I think, Susan, you made a great point that we need to think about the whole health of people we're trying to serve. So beyond just diarrheal disease, we need to to look at a much wider suite of health impacts and a more holistic view of WASH impact on health. And you made the mention that NTDs are one piece of that, but there are others, HIV, AIDS, and malaria, and others that are related to WASH. And I, perhaps just as a way to stimulate discussion among WASH practitioners as you go through this course, the idea is how do we include NTDs within that more holistic perspective? And I think the mapping and monitoring tools that both Susan and Rachel have presented today help us to begin to think about that. Is precisely what role can NTDs take within that wider perspective, and then how can we realistically measure our impact on those? So Susan or Rachel, I don't know if you have any kind of closing comments with respect to that, or any further thoughts with respect to that, or any of the participants.
This is Susan. I think it's an important point, and it's challenging to think outside of our sort of traditional boundaries, but it's not that difficult to add in some of the indicators or even collect the data, and it's been nicely collected for you in certain cases, just to consider how you're affecting a particular set of diseases. And fortunately, you have this set of beautiful maps that you can use pretty easily without having to do too much extra. So it's, I think, a small step to consider an actually easier set of diseases that are easier to measure than diarrhea. It might make our jobs easier as WASH practitioners.
Great point. Yeah. And I think as pointing this out is a great place to start. To some degree, the advantage here is that a lot of this data is being collected already, and so it's data that we can take advantage of as the WASH sector. I think, Rachel, in your concluding slide, or one of your concluding slides too, you mentioned some of the indicators that would be really important to pay attention to from a WASH sector perspective in order to be more indicative of progress towards NTD control. And I think you mentioned, for example, use of latrines or sanitation use in addition to, for example, just access, or hand washing behaviors in addition to just access to hand washing infrastructure, use of soap, et cetera. And this is a conversation that's ongoing in the WASH sector as to how we can effectively measure and include indicators that are more nuanced than just access to infrastructure, but really help us to understand practice, which in the end is what will have an impact on NTDs. So I think that's another conversation worth continuing, is how do we effectively collect data on those particular types of indicators.
Yeah, I agree. And I've noticed a couple of the participants here have made the same points, that the standard data that's collected in terms of access to improved and improved latrines and collected by the GMPA may differ from the data that's collected at countries. If you look at different studies assessing the impact of WASH on NTDs and on other diseases, indicators vary hugely, and there is a real important need to standardise these definitions and ensure that we develop definitions that are of direct relevance to disease transmission, so that we can better capture what's going on.
And so, Hal, I see your point that the Health and WASH Nexus has recognized that there's a need for both sectors to arrive at a list of common goals and indicators for measuring the impacts and be more holistic. And I think you're right. I think that this is a conversation that we have that has been ongoing in the WASH sector for a long time. As someone who is a WASH practitioner myself, and someone who's also been at the intersection of WASH and NTDs for the last couple of years, the tremendous opportunity that I see in the NTDs is precisely to further that dialogue. Is that NTDs could be an entry point, an easy entry point in extending that health sector dialogue. Because there is so much data collected and because there is so much data available, And particularly because we have been able to overlay this data with WASH data, we have this wonderful opportunity to start looking immediately at WASH association or impact on the NTDs. And so it gives us an easy entry point to really extend that discussion. So I think I see the NTDs as a way to begin to look further into health impacts at a more tangible and practical level that addresses the questions of how do we measure that impact.
I just want to thank everyone again for the great questions and thank our wonderful speakers. The presentation will be available for you to re-watch because I know that there are definitely some very important points in there, and you would love to review the slides again and find the resources and look at some of the different indicators suggested by Susan. And so thanks again to our speakers. Thanks again for everyone who was able to make the change of date. Our next module and our final module, sadly, is on December 3rd at 12 noon GMT. So once again, email me if you have any questions or comments. I look forward to seeing everyone's assignment 2 coming in soon. And thank you again. Also, if anyone has additional questions or comments, we'll stay online for a bit longer, but everyone else feel free to drop off and go to bed or get back to work or whatever it is you need to do. So thanks so much.